I worked a 10-hour shift yesterday, and 12 sets of blisters. It's almost embarrassing because 12.
Maybe 12 a year.
Well, depending on the year, right? And our guidelines basically are very strict, and if these patients get admitted and down the line they get diagnosed with pneumonia, the clock started when they walked foot in to the ER. So it's clear that a government-run healthcare system is not in the best interest of our country. In addition to being an inefficient monopoly, it would regulate our choices and ration our care, and really take the medical decisions out of the hands of the physicians and patients. So I think it's a bad idea across the board. There are a couple of issues I wanted to talk just briefly about, and I don't want to bore you with the economics and the sustained growth rate of Medicare. But there are a lot of issues with Medicare. Medicare really is having a hard time financially making the reimbursements. It's in debt, and they're theoretically going to cut it by $50 million. There are already physicians that will not accept Medicare patients, or patients that are reducing the number of Medicare patients that they're accepting. Even the Mayo Clinic just recently announced that they were going to start cutting Medicare patients. And so we end up with a situation like in Canada. So you've got a Medicare card. Well, if you can't find access to care, what good does it do you? Under the current legislation, Medicaid is also a big issue, and they suggest that it's going to be expanded by 30% for the first 2 years. Of course, that's going to be paid for by the federal government. And then they're going to mandate that the states pick up that bill indefinitely. That's going to be a huge financial burden on the states. And right now, I mean, there aren't even the physicians that are going to be able to take care of those patients. After the 2 years, of course, then the states pick that up, unless you're in Nebraska. I'm not suggesting that anybody goes to Nebraska, okay? Because I have a feeling that those things are going to be changing.
It's been an expensive election for Nebraska.
It's a very expensive. Anyway, I really feel that it's a financially irresponsible direction, the current legislation, and one that will do nothing to preserve the quality of care and the rights of patient choice and the doctor-patient relationship. From an economic standpoint, it doesn't take advantage of the competition and individual ingenuity that leads to greater cost control and effectiveness. So I really think that we need to embrace responsible reform. One thing I do also want to emphasize is that getting the citizens to be more active consumers is critical, similar to what Mark said. When people are directly involved in the decisions regarding their care and the financial choices and the financial impact it will have on them, the system works with kind of everybody sharing the same clear goal. And I would have to add to that, not just the consumers, but the participants and the providers. I mean, I'm as guilty as, well, I don't know, maybe I'm more guilty than my cohorts here, because somebody comes into the ER and you're absolutely right, they whisper chest pain, you handed the EKGs and everything goes. I have no idea how much that costs. I have no idea how much I charge a patient every time I order an EKG. So I think let's see this word, transparency. I think that transparency needs to occur not just from the people who are spending the money in the sense that where the patients go to receive their care, but also the providers need to be a little bit more involved in understanding the financial impact of those choices. Because I have no idea how much a CAT scan costs. I have no idea how much a lumbar puncture costs, or half the things that I do. So I think that, and I'm somebody who's actually pretty involved. So I think we really need to get the providers on board. We need to get the physicians to be responsible, to understand that, where the financial burden is going to end up, understanding what kind of financial burden you're creating every time you see a patient, order a test, make a recommendation. In the United States, we already have the infrastructure to provide quality, efficient, technically modern health care to our citizens, and we do this every day. Every year we see advances in healthcare as the doctors and nurses and other players in the healthcare team strive for better results. That's what we do. We want to do better things for our patients. We want better outcomes for our patients. And really, I think this is what drives our whole healthcare system, that there are incentives to be better. And I think if we trade that off and gave some of the control or most of the control to the government and went towards a more either socialized like in Canada or nationalized system like they have in the UK, I think they're going to lose that incentive to make a better system, and I think it would not be what's right for our country. So I encourage everybody to stay involved. Obviously we need to get all the players on board, and we need to pull together to protect the health of our citizens and the financial future of the nation.